This meeting is being recorded.
Oh, there's my mom.
Perfect. Oh, and I see Alicia as well. Yay. Good morning, everyone. We are letting folks in from the waiting room and we'll be starting shortly. I want to thank everyone for joining today. We do have a change up on our agenda. The original agenda had indicated we'd be discussing tobacco cessation, and we are going to offer those tobacco cessation tools when we do our follow-up email out to the group with all of our materials. But we did want to take this time to talk about Unite Us and Connect Oregon for the Community Information Exchange. So we will be discussing that for the first part of our meeting today. I did want to take the time to introduce myself. My name is Sarah Smith. I'm the Yamhill Community Care Organization Provider Relations Supervisor. With me, I have Deanne Carr. Deanne, if you want to introduce yourself.
There we go. Find the mute button. Good afternoon. My name is Deanne Carr, and I am the Behavioral Health and Integration Director for YCCO.
Thank you, Deanne. So our agenda today, like I had mentioned, we did change things up a little bit. So we will be talking about CIE instead of the tobacco cessation as originally indicated. So Unite Us will be presenting. Then we have Alicia and Courtney from our customer service, claims, and PH Tech side that will be discussing claims, timely filing, provider reconsideration process, and the corrected claims timeline. So, oh, whoops. Oh, I'm messing things up. Sorry. My screen's going a little crazy. Here we go. Let's see if I can scroll back down. All right. So after our Unite Us presentation, like I said, Alicia and Courtney will be on from our claims department to discuss claims timely filing, provider reconsideration process, and the corrected claims timeline. Then we'll have robust time at the end for questions. Again, these questions can be anything about the behavioral health transition. They're not just relegated to the topics that we've discussed here. Feel free at any time during our presentations, if you have questions, go ahead and put them in the chat. We will have folks monitoring the chat. So if we don't get to it during the presentations, we will address it during the Q&A time. And then we'll have a meeting wrap up. And this will be our final behavioral health transition forum. So I appreciate everyone coming to join us for our final forum. And I'm going to go ahead and stop sharing my screen so I can let our Unite Us Connect Oregon folks take over and introduce themselves and share their screens.
Great. Thank you so much, Sarah. Really appreciate you. My name is Mamone Maley, and I am the Senior Community Engagement Manager on the Connect Oregon Network. Your local community engagement manager is Joyce Stone, but she couldn't be here today, so I'm happy to fill in. I previously worked in the Mid-Valley region, which is a large region that includes Yamhill, and did some work previously with some of the Pacific Source kind of areas of Yamhill. So I'm joined today by my colleague, Devin. Devin, would you like to unmute and introduce yourself before I start with the presentation?
Yeah, thanks, Simone. Hey, everyone. Devin Hicks, Customer Success Manager here with Unite Us. And I've been with the company since February of last year, so just a little over a year now. I'm just across the border on the Vancouver, Washington side. I've been working with Optum Care, Community Health Plan of Washington. I've done some work with Pacific Source in Oregon, and really, really excited to be partnering with YCCO and helping with their implementation and post-onboarding experience. So it's wonderful to meet all of you today.
Great, thanks so much. And just so I can gauge the room a little bit, because I know there are some really small areas of Yamhill, or a few partners already in Yamhill from previous launches. On a scale of 1 to 5, if folks could type into the chat, 5 being you're already on the network, you already use Unite Us, 1 being you've never heard of Unite Us or Connect Oregon before. Could everyone just put kind of where they are on that scale? 1, pretty much no knowledge, 5, already a user. Great. Good. Okay, good. I like when there's at least some consistency with where everybody is in their knowledge. That really helps me today. So I'm going to go ahead and share my screen and get started. Great. So Connect Oregon it's a network of partners using the Unite Us platform as a community information exchange. So the vision, we're collaborated here with Yamhill CCO, who with their collaboration, we're able to offer licenses widely for multiple different types of organizations. So we're really looking for we're empowered to identify and connect members to community resources they need. So I'll talk a little bit more about how our tool helps to support that, how the Connect Oregon team is here to support you all in this community vision. So you've already heard 2 terms a little bit today. You've heard Unite Us and you've heard Connect Oregon. So Connect Oregon is really the network of social service providers and healthcare providers that use the Unite Us platform to send and receive referrals on behalf of their patients and clients, and to really coordinate care and wrap around some of our most really vulnerable community members in Oregon. So we're able to provide several no-cost licenses, especially for those nonprofit organizations on the platform, which helps to facilitate that community connection from clinical healthcare to those community-based organizations that otherwise would maybe experience some barrier to being able to access certain softwares, platforms, or networks. So with this model, we really hope that we can get large participation, which we've seen happening in the areas where Connect Oregon is already live. So Connect Oregon is really a person-centered and community-based network that allows for providers to quickly connect their clients and patients to the services they need, as well as to track the outcomes of those service journeys outside of the walls of your own organization. So when you send a referral to a partner on the Connect Oregon network, you can track what the status is and what's happened with that individual on their service journey. And it's all really easy. With just a few clicks, you can see every referral you've ever sent, what the status is. And with one more click, you can click in and really see what the notes are, what the updates are, and ultimately what the resolution is or what the unresolved outcome is of that service journey. So just a little bit about client privacy with Unite Us. It's definitely a priority for us. The Unite Us platform is HIPAA compliant and fully aligns with the strictest federal privacy regulations, including 42 CFR Part 2 and FERPA. So when you're sharing information, sending a referral on behalf of a client, you can do so more securely than you may have been able to previously through some more historical referral methods. So this is where we are so far in Oregon. This map shows the dark blue counties. These counties are where the network is already live and folks are already sending and receiving referrals on behalf of their clients and patients. So you can see Yamhill is covered in there. Again, that was part of our work in Polk County. So it's just a small amount of Yamhill where some of this work is already launched, but we're looking forward to expanding throughout all of Yamhill County and getting the community engaged and getting more Oregonians served here in Yamhill. Great. So those light blue counties, those are counties where we have upcoming launch dates later this year. So this will become available to all communities in Oregon by the end of 2022. So why participate in Connect Oregon? What really is the difference if you choose to make a referral by phone or email versus through the Unitas software? So first, I shared with you that Unitas is HIPAA compliant, but we're also HITRUST, SOC 2 Type 2, and NIST certified, which means we follow the highest security frameworks in the industry. Second, we recognize that it's challenging to match a client with the best fit organization for them based on multiple factors like eligibility, the location where the client lives or receives resources, and also the capacity of the organization that we're sending a referral to. In the Unitas platform, we're given unique filters that we can search for and criteria that we can take into account so that we can more easily and quickly match individuals with the resources that'll be the best fit for them in the community. And we oftentimes will, when we're working with a client, connecting them to resources, we'll share with them brochures or phone numbers, which really, puts the responsibility on the patient or client to navigate their service journey themselves. And we know with folks who are experiencing a crisis or a hardship, that can be isolating and difficult. So with Unitas, we're trying to really shift that narrative by taking the responsibility back into our hands as experts and service providers. So we have, with being able to share information about patients and clients, we're able to take a more trauma-informed approach in serving clients and really wrapping around them and tracking so that they're not falling through the cracks. And that really gets back to one of my favorite things about the platform is being able to easily track where is the status of that referral, what's the outcome for the individual that I'm working with. And all of that can be done so quickly and easily. So ultimately you're left with just following up with maybe a few referrals that are still kind of needing action or that you don't have that resolution or outcome, rather than having to really track individually by making phone calls to each individual provider where you've sent a referral. And then with the Connect Oregon network, we really take a no wrong door approach. And we have several ways in which we do this. Of course, clients can enter through any of our partner organizations, whether that's a social service organization or a healthcare organization, behavioral health organization, wherever it may be. They can get connected to coordinated care through entrance through that organization. We also have an assistance request form. So we have multiple places where this assistance request form is housed, and we also have a unique configuration option that's free for all network partners. So the assistance request form, right now, it can be found on 211's website. It can also be found on our Connect Oregon Get Help page. We also have several partners who have configured their own unique assistance request forms that ask their unique intake questions so that they can allow clients to self-refer to them through their own websites. What we see is that this really helps for those folks who might be reaching out and trying to receive services outside of normal business hours, right? So folks who are working during the day and they can't always make the phone call during the business hours of an organization. So this is definitely something that's helped many of our organizations better serve and connect to the communities that they serve. So I would love to walk you through an example of how a client would receive services through Connect Oregon. So let's pretend that in this instance, you're Sue, and Sue works at maybe a clinic, and maybe Sue is a health coach, or is working in a resource navigation role. So Tom comes into Sue's organization and identifies that Tom has a need that her organization doesn't provide. Perhaps he's seeking food. He's having food insecurity. And so what Sue can do is log on to the Unitas platform, search for a food service provider within an area that is accessible for Tom, and send a referral directly over to that food assistance provider. The food assistance provider then receives an email notifying them that they have a new referral through Connect Oregon. When the food assistance provider logs on, they can review some basic information about Tom, determine if they can accept the referral, and if so, they accept the referral and they can provide what the outcome was and provide that service to Tom. Now, we know that not every referral will always be able to be accepted, maybe because of capacity or eligibility. So we have several options. Referrals can be rejected. They can be sent on to partners, because usually organizations that are working in a specific service type will know who are the other strong community partners, and will be able to send that referral on to maybe the most appropriate organization. So that's one way that we're able to really collaborate. Furthermore, if the food service provider identifies additional needs that Tom has, she can send referrals for those additional needs, maybe help with finding childcare or establishing primary care or whatever it may be. So in this way, we're really able to work together off of a single client profile and provide wraparound care for individuals. Great. And I apologize. It looks like, oh yeah, we've got the right ones here. So we do have some upcoming information sessions that we would love for you to attend. I'll provide those links in the chat as soon as I'm done sharing my screen. But these information sessions, they allow you to, they're for all interested organizations around Oregon. So we provide a software demo. We get your feedback and input to really understand more about your concerns and what kind of how the network might work for you. So we would love for you to join us, learn more, and so we can take next steps with you accordingly. Also, you can reach out to your local community engagement manager, Joyce Stone. Here's her contact information. So some of the things that Joyce can help you with is having a workflow conversation, looking really at the processes within your organization to determine how the tools on the Unitas platform can really support your staff and the folks that they serve. To join Connect Oregon, you have to submit a partner registration form. And so Joyce can definitely help with any questions you have with that form. She can also help with getting you routed to a software training or doing a training for your organization, and can talk to you about different opportunities that may be available to champion the network and really grow this network in Yamhill so that it serves its highest purpose for you, your staff, and your patients. So I would love to take any questions that folks have right now, but I'll go ahead and just leave Joyce's information up here for another moment so that anyone can take it down who might need it. Devin, did you see any questions come in that you'd like to kind of address with the group right now?
Yeah, thanks, Mamone. I did address those in the chat box, but I know Tracy had a question about kind of the consent process and BAAs. So we do collect BAAs from partners that are considered covered entities to make sure that the information exchanges, follows procedures. And then, like I mentioned in the chat, the patient or the client themselves would also have to consent to have their information shared within the Connect Oregon platform before that referral can be sent. So if they choose not to provide that, it wouldn't be sent. They can also revoke their consent at any time to have it removed. But we'd love to field any other questions there might be.
Please feel free to unmute if you have questions. I'll start putting those registration links into the chat for you all. And I think I can also provide them to Sarah or Dee Dee accordingly to share out with the group after.
That would be great. I typically do a follow-up email. I try to get it out by Friday or Monday of next week, kind of highlighting some of those resources and providing those. We also provide a link to the recording so folks can review it again if they need to. So I appreciate that. Thank you.
Sure thing. Thank you.
Right. And it looks like we are a little ahead of schedule. But hearing no questions so far, we'll go ahead and turn things over to Alicia and Courtney to talk about claims. Alicia, are you there?
Sorry,
Hi,
I was
yes.
talking. Did you not hear me?
I did not hear you, Courtney.
Oh, sorry.
Okay.
I went through this whole introduction spiel. Oh, the joys of this. My name's Courtney Finley. I'm with PH Tech, and I've got Alicia Reyes, our YCCO claims lead, on the phone with me as well. We're both here to talk about timely filing, and just real quick, I'll share my screen with some of the information, and we'll also provide this to Sarah after the fact, after the meeting. Can you see the Word document? No?
Yes.
Okay, thank you. So just a high-level review over timely filing submissions for YCCO claims. Original claim submission is 120 days from the date of service. Corrected bills being 120 days from the transaction date. And transaction date you might also know as either the check run date or the claim payment date. Claim reconsiderations, 180 days from the transaction date. And then denied prior authorization reconsiderations are 60 days from the denial date. COB, so coordination of benefit claims, either secondary or tertiary claims, is 1 year from the date of service. And pregnant members, which I'm not sure this would necessarily apply to behavioral health claims as much as it does physical health, but those are 1 year from the date of service as well. Any questions around those timelines?
Hey, Courtney, is there any way to zoom in a little? Folks are having a hard time seeing that.
Oh, sorry. Yes. Is that better? Getting better? Okay, perfect. Corrected bills, 120 days from the transaction date, and those would consist of fully corrected bills. So no partial corrections within a claim. The whole claim needs to be submitted as a corrected claim. And then corrected claim should not be submitted as a claim reconsideration. They need to go through the normal claim submission process to be considered a corrected claim. And then over on the right-hand side are the timelines and how and where to submit provider reconsiderations for dates of service on or after January 1 of this year. And again, like I said, I'll provide this information to Sarah so she can send it out following the meeting. Alicia, did you have anything else to add, or are there questions from providers about these timelines? Questions about claims overall? Okay. Well, with nothing else, Sarah, I guess I'll punt it back to you.
All right. Well, that was wonderfully quick. Thank you. So I am all for that. So I appreciate it. Does anybody have questions about this transition overall? We are now, 3 months into it, where we've transitioned to our Providence Plan partners. Most of our contracts are configured, and I'm just wanting to give this opportunity, since we have, Deanne here, as well as our partners at PH Tech, to just see if anybody has any questions, burning questions moving forward. This is a time to share, troubleshoot, talk. We still have a half hour. If we don't have questions, you can always reach out to me if you have questions that you think of after this, or you can reach out to Deanne. Customer service is also an amazing support during this transition. So if you have questions specifically about your claims, where they are in the process, things like that, please reach out to our customer service, because they can walk you through that process as well. So if you have questions, I'll open it up for that right now.
Well, and I know that billing and claims and all of that can be hot topics. So I don't know, were there areas related to billing that you would appreciate more information? Are there, where are the primary areas of struggle that people run into, or confusion? Or y'all are just, got it all figured out, which is good too. That's definitely a Wednesday. I think over time, there'll be more discussions around billing and around coding and things like that. I certainly think, I'll just talk in general. There's, things on the horizons. There's certainly conversations bubbling around at the state level, which will probably take a while, but looking at the 0 to 5 children's population and the differences in how presentation manifests, and whether there's more opportunities for effective pairing of diagnoses with services and things like that. So these are some of the things that are on the horizon. And so the more that we as an array of providers can talk about where maybe certain challenges may be popping up, that may let us as a CCO know if there's areas that we need to do more advocacy at the state level. And I'm certainly happy to make a pest of myself at assorted meetings and really try to speak for the provider communities and where we can improve the system and the processes. We're also currently working on the CCOs collectively to push back on some of the administrative burden. We'd certainly like to take another run at the 309-019 Oregon administrative rules. And that's sort of where you get a lot of your language around assessments and service plans and service notes. So we're also doing work on those issues as well, to really try to make sure that we have requirements that make sense for service delivery and address quality of care, while simultaneously really trying to be as streamlined as possible. So I don't know if that triggers any questions, but I just did want to share that there are efforts to try to make things a little easier, but obviously that'll take time and a lot of conversations.
So I have a question. Thank you for doing this. It's helpful to see people involved. I I have a question a little bit about following up on the Unitas program, which sounds like a really great program. I'm a mental health provider in private practice, and I see very few CCO clients. So it always takes me a while to get back into billing. But I'm curious about if I'm interested in signing up for that program or being a link in that. I'm not clear about all of the pieces. How do I go about that? How many people are currently involved? Are all the services in Yamhill County part of that network right now, so that I would have at my fingertips the resources to be able to refer a client to services, or where are we with that in Yamhill County?
Those are great questions, Amy. We are in the early phases of adoption. So as we move forward, we will be reaching out to those partners that are interested. You can also reach out to me and reach out to Devin Hicks as well, because we're keeping a tally of those that are interested, but we are not fully implemented in Yamhill yet. We are working towards getting implementation. We're meeting weekly to get that going, but to answer your question, we are not fully implemented yet.
Okay, so at this point, you'll be reaching out to us when you're ready to help us sign up, or just let us know that it's available.
Yes, and like I said, I would encourage you to let Devin know that you're interested, because we don't want folks that are interested to fall through the cracks or get missed. So if you
Okay.
are interested early on, the sooner we can find that out, the better, because then we'll know where our licensures need to go and where we really need to focus our efforts. So
Okay, great, thank you.
do we have any other questions? I'm seeing that we have some in the chat that are getting answered. So thank you for those who are contributing to answering those questions in the chat. I did want to let you guys know, if you do have questions about SIM, we did have a SIM training late last year, so I can offer that recording as well. If you just need to brush up on it, just let me know after this meeting. Again, I will be doing a follow-up email that will have the recordings along with supporting documentations, contact informations, and things like that, that you can use as a resource as you serve YCCO members. But if we don't have any other questions and no other topics, then I would love to give you some of your lunch back. And again, thank you for attending our final forum. I really do appreciate it. And I look forward to working with you as you guys work with our Yamhill CCO members.
Thank you for making this effort.
Thank you.